Well, with any asset, you have to have a identification number linked to this. It could be a barcode or it could be a QR code. And then you have that particular piece of information on that piece of equipment. And then you'd have a program that you could track that. So if it moves from a different school or from a different hospital to one room to another or building to another, you can track that piece of equipment. Also with that code, it can track the history of maintenance. If somebody comes out, say for example, you're taking care of a car, you have a van that's specifically for the hospital. You might have 7 vans that the same year, the same make, the same model, and that identification code tells you which ones are different. So whenever you get those vans serviced, you know if you had the new tires or if you changed the oil, if you put in new air filters, things like that. So, and you can set up a history for that piece of equipment, all based on that tracking ID. But you have to have an identifier someplace for that specific piece of equipment. So you can put it on a CAT scan, you can put it on blood pressure, you can put it on x-ray, you can put it on a hospital bed. You can also go down, go into the kitchen, the cafeteria, you can put it on that equipment. You can go up on the rooftop, you can put it on the air conditioners, the air handlers, the heaters, and have that history for that specific piece of equipment. You might go out into a hospital and you go up on the roof and it might have 150 air conditioners on top of that roof. And even though it might have a serial number or a model number on it, this identifying QR tag tells you which specific air conditioner that's getting worked on. And so you can have that on file on the computer.